Hey everybody, Dr. Brad Whitley here at Bespoke Treatments in San Diego. Today we're inside of our Carmel Mountain location and we're going to go through our last set in the 4-week series of posture and low back. Today's emphasis is going to include a Kinesio Tape job and some modalities to help with posture and low back. So a couple of things about this. We're going to go through one modality set including Theragun. So what I'm going to have you do is I'm going to have my friend Dan come in here. He's going to go ahead and sit facing the other way. I'm going to grab my Theragun or Hypervolt percussive device. Best way to get low back posture emphasis is you're going to go up and down the spinal erectors. So that big column, that meaty part of the back coming through here, we're going to go on the low back and mid back, upper back. 30 seconds to a minute on each side. This is going to promote some parasympathetic relaxation and provide some temporary pain relief. So taking that Theragun, you can bring it on whatever setting that you prefer, coming down the low back, on right there, and then coming across and moving it up. I'd like to go at least 30 seconds up to a minute on each side to promote that parasympathetic relaxation. Perfect. All right, and the next thing we're going to do is do a Kinesio Tape job. This is going to provide some short-term pain relief and going to cue posture in a way that's going to be really helpful for the patient or client. So what you're going to do is you're going to grab a couple of 6 to 12-inch pieces of tape. What I'm going to do is I'm going to pre-rip these an inch on each direction, and then I'm going to anchor them, and I'm going to have Dan sit up nice and tall. I'm going to anchor from about mid-scapula on that one end. And then I'm going to take a little bit of a stretch. Take the backing off of there. I'm going to stretch it so you can see the holes open up. And I'm going to lay that mid portion down. And then I'm going to anchor it. I'm going to go same thing on the other side. Pre-rip an inch on each side. You're going to anchor on the other side of that spine. You're going to rip, stretch until you can see the holes, anchor down at the bottom. So for me, I like to follow, again, those spinal erectors. And then what Dan's going to feel as he is typing at his computer or sitting at his desk is when he slouches, he's going to feel a nice stretch effect that's going to cue him to sit up nice and straight. So if he goes into that flexion, do you feel that little stretch coming through there? And then he can sit up nice and straight. Cool. So these are just a couple of ways. You're good there. Thanks. A couple of ways to cue with modalities for posture and low back. Many ways to kind of get you into better posture and improve back pain. And this is just a couple of things that you can do. Remember, solving pain is multifactorial. We want to make sure that we're covering all bases. So this is including things like we covered with stretching and mobility in the first 2 weeks, and especially that strength training set that we included last week. Modalities and pain relief are a part of the problem to be able to solve it. So make sure you're including all 4 of those: mobility, stretching, strengthening, and providing some pain relief. Thanks for watching the series. You can contact me on our website and Instagram, and let me know if you have any questions.